Hi everyone. Our project is on big data analytics on substance abuse, presented by myself, Kumar Shubham, and Deep Bora. Our dataset is of 4 GB and more than 300 attributes. Our dataset is collected from the Centers for Disease Control and Prevention website. It conducts annual survey since 1988, and we are collecting data from 2011 to 2018. The dataset has all sorts of chronic health conditions data plus demographic data and health related lifestyle data. Our goal is to find trends in health related risk behavior and predict if chronic health heart stroke, kidney failure can happen in future across all the US health using this survey data across all US health states and territories. So our solution is simple: collecting data, ingesting into Hadoop, and running our Python file, which has transfer data transformations and model written on it. Going forward with the analysis, we first did our initial analysis and found that our data sets has more weights towards the negative values and needs to be sampled. And then we first checked the population across US states and territories and found that Nevada has highly participated in this annual survey, followed by Florida, Washington, and New York and Washington. Going forward with the univariate analysis of all the categorical data sets, we have mostly zeros and ones in our data. So you can see the population of obese are most, and followed by the physical active and inactiveness, high blood pressure, diabetes, and others such as health coverage, smoking habits, alcohol drinking habits, and depression and high cholesterol. Going forward with other such of analysis like population which has no health coverage, so Florida was one of the top state which has no health coverage. And going forward with another like who are obese, and who are which state has the highest alcohol consumption, and which state has the highest already have the heart disease. So we found in this case that Florida was the one of the top state which has seen all the three things like heavy alcohol consumption, obese population, and existing heart disease. So we went ahead with the demographic analysis of Florida and found that the Florida has equal number of gender distribution, but male has the highest heart disease in Florida. Going forward with the employment, mostly everyone has employment, and going forward with the category distribution is the people who are aged beyond 60 mostly lives in Florida because of its weather, and since it's also a holiday place. Going forward with our analysis, we found that population with chronic condition and no change in their lifestyle, so male are having high cholesterol, high blood pressure, and may get heart stroke in future, which we will discuss in the next slides.
So coming on to the model implementation, we initially went with like balancing and removing inconsistencies and outliers. And then we did some data analysis that is univariate, bivariate, which you saw in the previous slides. And then we splitted our data and eventually we changed the label values and fitted it into the random forest. So our results mainly include of kidney failure detection, kidney failure prediction, and heart stroke prediction. So when we went with F1 score comparisons, we have our kidney data set coming in high as 0.94 and heart data set as 0.86. So this is because our kidney data set has much more categorical values when compared to the heart data set. So coming on to the ROC curve, we can see ROC curve with the AUC of 0.65 in the heart prediction data set, as well as the kidney failure and with the AUC of 0.72. So basically, these models improve our capacity to anticipate and manage long-term health issues, which increases the likelihood of focused interventions. So these results highlight the relationship between lifestyle decisions and health outcomes, highlighting the necessity of comprehensive public health initiatives catered to certain populations and geographical areas. Thank you.